that's just like, you're going to have it come up again through medical school. Of course, you have organic chemistry and chemistry, those things you have to do. Psych is always good for sure, especially in this field.
Okay, yeah. Like when you were, did you always know you wanted to go to medical school? When did you?
My dad's a surgeon, so I wouldn't say I always knew that I was going to become a doctor or wanted to do it, but I definitely, by the time I was like teenage years, when I went to college, I went with the intention of probably going to medical school. So I kind of knew that I liked that. I always liked the sciences more.
Yeah.
I definitely didn't know if I wanted to be a surgeon or what. I just kind of, actually, I remember when I applied to college, I wrote my essay to get into college. I think I wrote up I wanted to be an endocrinologist and work with diabetes and hormones and actually nutrition, maybe because I was applying for a nutrition major. I don't remember, maybe that's why. But so I wrote about that's more primary care even. So I didn't even know. I had no idea what I was going to do until probably into medical schools when I knew surgery versus medicine. But in high school, I think I kind of started to know that I liked sciences and liked the idea of doing medicine or something like that.
And how many years of like education did it take you?
So for me, it's like different with like the way the years are. So high school's goes up to you're like 18 when you finish high school. So after high school, I did 4 years of college. Then that's when you apply. I went to medical school. Actually, I took a year off between college and medical school. And then after college, I worked for a year in research and did cancer research. But then I did 4 years of college. Then I did 4 years of medical school. Then I did 5 years of residency. And then another year of fellowship. So it was a lot of years.
Wow.
So it's a lot of years. And then I worked between college and medical school because I just wanted to, I thought I was going to work and then travel.
And how long have you been a doctor now?
Oh, from here? It's been 6, I've been here after fellowship at least 6 years, right?
And how old are you?
How old am I?
Yeah.
I'll be 39 in November.
See, you're still so young, even after all of that schooling.
All of that. Yeah. Yeah.
And how did you decide to be a head and neck surgeon?
So, those decisions you make kind of step by step along the way. I find the first decision is you kind of learn pretty soon into medical school. Maybe not some people it's sooner, some people it's right at the end, but you kind of realize what approach and how you like to approach patients. Some people like dealing with more overall health and more of the detective work, the diagnostics and the management of people, and that's going to be more the medicine side. Then other, like I knew I kind of liked the surgical approach, treatment, definitive kind of like, oh, you have a problem, let's fix it, let's do this, and even though I ended up in more of a cosmetic field, but that's even an attitude of even like a general surgeon. I mean, you've got a problem with your gallbladder, let's take the gallbladder out. You've got a problem with your joints, let's fix it. And it's different versus, there's always medical approaches to things that are another way of doing it, and some people like that. And some of it's personality too. If you're under stress or under, and you don't like that kind of like stressful environment, then surgery may not be the right choice. So it's different personalities, I think, but then it's also the way you like to approach patient care and your personality with that. So you kind of figure that out as you're doing things is what you kind of gravitate towards. But sometimes that's as you're kind of dealing with different patients or dealing with different rotations and how you feel on that rotation once you start to do that. And I think most medical programs, you don't have to make that decision right away. You shouldn't have to, at least, because sometimes your people are surprised. Some people who are dead set on being a surgeon realize they get in there and the feeling of OR, the feeling of being in surgery, or the feeling of interacting on that level, a different level with patients, is just not what they like, and they actually like a different environment, the discussions, the diagnostics, and the evaluation, and other things, and they decide to go totally different. Some people then decide they don't even like dealing with patients, and you could become like a radiologist, and you really don't have to even talk to patients if you don't want to, or an anesthesiologist where you just talk to them for a little bit and then you put them to sleep. Or pathologist, and you don't even deal with patients either in that. So there are so many areas of medicine that even if you find as you're in it that you don't like certain things, even if it's that you don't like patients, that you can still find a really nice area of medicine.
Okay.
So, but I'm sure you'll like patients, and I'm sure you'll do it.
And do you have like your favorite surgery?
I don't know. There's favorites. I always do. I like doing facelifts and eyelids. Those are always nice surgeries. But I'm sure it kind of waxes and wanes of which one's the favorite. But definitely like the surgeries that I like those because you just see like these nice changes and you get to really appreciate a really good result. So I like those. Yeah, and they're fun surgeries.
And out of all of like the surgeries you do, which one would have like the most risks?
Risks?
Most
I guess, I mean, none of them are that risky, but, I mean, facelifts, I guess, have more risks of having bleeding, and complications, probably than some of the others, but they're pretty safe. Thanks, Mary. You want me to answer?